Hi, I'm Dr. Joel Kahn. I'm from the great city of Detroit in Motown, and I'm born and bred there and did a lot of training at the University of Michigan back. And for more than 25 years now, I've been doing what's called interventional cardiology. I traveled all over the world in the 1980s, got the best training. 1990, I was ready, and I put in stents all over the body, largely in the heart, a lot of heart attacks, and still practice in the cath lab, which is still an invigorating experience when somebody's really critically ill. But my focus has shifted long ago. I've been plant-based for over 30 years and strictly plant-based for about 25 now, and have been teaching that to patients. And that really started, the year I finished training was 1990, and that's the year that Dr. Dean Ornish published a lifestyle heart trial. And I can so clearly remember reading that study and saying, I just spent years learning to fix and reverse heart disease with stents, and this young upstart is fixing and reversing heart disease with diet and lifestyle. And I could tell the quality of the research. And from that day on, I've been teaching patients, if you need a bypass and if you need a balloon or stent, you may need to have one. But if you don't get on a program like this or something similar, this is a Band-Aid. So I've been out there trying to convert Band-Aids into lifelong successes. And it's gotten, frankly, easier and more attentive. So most of my practice now is actually a preventive practice. I still interventional and preventional. I call it interpreventional. I'm still all over the map. But I will sit down with people and make sure that they get, the right information, watch the right video, read the right books, go to the right websites, meet back with me. I call it kind of my homework I give them. I write it on a prescription pad. And it's been making a big impact. People are grabbing on and realizing that the drugs, have side effects, that the procedures have danger. They don't want to go through it again. And they're willing to make changes. And in fact, in Detroit, some would say maybe one of the grungiest towns in America. I would disagree with that. We have a gigantic support group, 1,500 patients that are in a plant-based nutrition support group, and we get together and it's like a revival of health and fitness and wellness and really keeping people on track. So I'm more invigorated than ever that we can get a message to people that it's cost-effective, it's tasty, it's powerful, and it's life-sustaining. And if you have something you want to live for in life, whether it's a job, a grandchild, a spouse, a new phase of retirement, whatever it is, get your health in order, because otherwise you're not going to have that dream fulfilled. So I'm all about fulfilling dreams, I think. When I sit down with a patient, I usually am looking at somebody that half the time is from a pretty deep blue-collar area where this sudden transition to a complete plant-based, no added oil diet is going to be shocking. So I take baby steps. I really do try and get breakfast down. I try and get them off of eggs and bacon, and I really try and get them off of processed food through the window, through the yellow bag. I have a whole series of slides in the office about what an Egg McMuffin does to your heart arteries and how quickly it deteriorates them. So I want them on oatmeal. I want them on some healthy pancakes without the butter that I give them a recipe how to make. I will get them occasionally to make a green smoothie during the week, just as another option to get some more fruits, vegetables, and seeds and nuts into their diet, and the whole gamut. And once they got breakfast down, at least almost every day of the week, we'll step it up. But it's baby steps, unless they're critically ill. If they're critically ill, boom, we're going right from the get-go. I have patients that absolutely reproduce what Dr. Ornish said. 3 weeks, chest pain goes away. 3 weeks, medications start to become completely effective, and they're not in the emergency room anymore. So either I pull out my big mallet to hit them hard if they have to, and for the rest, it's constant follow-up. And now I just put them into the support group, and it's kind of like autopilot. They're around people, peers, and they get this enthusiasm that they can control their health. It's wonderful. My big mallet is, really hitting them that by the 2-week time I probably don't see them back, I want them watching Forks Over Knives. I want them visiting the McDougall website. I want them on Forks Over Knives website. I want to read the China study. And really, I want them to get some no added oil plant-based cookbook to start working on eating. And I want to make that transition rapidly and stress to them, this isn't just an option. I mean, this is proven science that is powerful. In fact, I find it more powerful than any pill that I have in terms of how quickly they'll come back and say, I have more energy, which is nice, but I really want to see them have less chest pain, less nitro, less need to run to the emergency room. So the big mallet is jumping into, I think, the only science-based dietary program there is for heart disease, which is a completely plant-based, starch-strong, no added oil diet, and very easy to do in my opinion. I am still in the cath lab for acute emergencies. If you're in the emergency room and you're threatening or actually having some form of heart attack, you need to go and you need to embrace medical science, and it has saved many lives, and many patients are around because of that emergency stuff that I did. But that's a subset that makes up less than half of the people that are ending up in a catheterization laboratory and are being considered for angioplasty or bypass. And they're not getting reached by the science of nutritional medicine and conservative medicine, unfortunately, unless they just happen to stumble across a cardiologist like myself. Of those, I would say the vast majority can be managed with lifestyle, with some medication, and proper observation, and they do not need to have their arteries intervened on with a piece of stainless steel. They can have their arteries intervened on with a fork as a piece of stainless steel, and it's very effective. And it's just, unfortunately, the only process is a little bit of peer review. The insurance companies don't really stop the process. I have more trouble getting a $200 echo heart scan approved than a life-threatening, potentially, catheterization and stent procedure. So the system is still at fault. In Detroit, I was the first physician consistently talking about nutritional medicine and the key importance of food as a medicine, and that's been my entire career. I'm glad to say there are at least 2 other cardiologists in Detroit that are also speaking that way and living that way, and I'm happy to share this with everybody else. But as an example, I practice in the biggest hospital in Detroit, and the only place you can get fried food in that entire giant and world-renowned institution is the doctor's dining room. So 25 years later, I'm still distressed that the message in the larger medical community that food is an effective medication, is an effective strategy to stabilize, reverse, and more optimally prevent disease is not reaching where it needs to reach. And I think it's being diluted by Time Magazine, Wall Street Journal, New York Times. That's where doctors are getting their nutritional information, because it's just never a grand rounds topic. So I'm not pessimistic, but because I think the new accountable medical situation where the way patients perform is actually going to start to matter in terms of pocketbook, I still think there's a good chance we can institute lifestyle into the medical model. I just don't see any difference in 25 years, which is disappointing. My real passion, besides speaking about heart disease reversal in those that know they have heart disease, been to the emergency room, been to the cath lab, is the early detection of heart disease. And I'm into that particularly because it's very motivating. So there are ways, and I'm a big proponent of something called a coronary artery calcium CAT scan. 10 seconds in and out of a machine. You're 50 years old, I'm fine, I'm playing squash, I feel great. Boom, either you have arterial calcification, which is heart disease, or you don't. I find that very motivating because I'm always talking to these people about making lifestyle change. But they put that picture on the refrigerator of their left anterior descending having a pocket of calcification, the widowmaker. They're probably not reaching for the ribs and fries. They're probably reaching for a sweet potato and a salad and an almond milk rather than a whole fat milk. So I'm really big into speaking everywhere I can because tragically I have a whole following now of widows or widowers that are in their 40s and 50s that said, I wish somebody could have picked up this silent heart disease. And it is both detectable and, more exciting than that, it is responsive to lifestyle the earlier you catch it. So it's a 1-2 punch that I love to speak about.